one, 2 in 1, all go in a vein. And I just want to make sure you know that. Remember that muscle mass at waist. If somebody's bedridden, their BUN may go up. Their waste in their serum may go up. Uric acid, urea, all those may go up. Pyridium, it's in your medications, page 20, I believe. I wrote that down, pyridium. Pyridium is a medication that helps only urinary tract pain or discomfort. It doesn't cure. And so it's palliative. Palliative helps make you feel better, but palliative isn't a cure. Palliative. And so pyridium, Pyridium, is a palliative treatment for urinary tract. The self-intermittent catheterization on page 9 in your briefs, SIC, S-I-C, self-intermittent catheterization. And it's just that. Someone catheterizes themselves. And the stats or statistics show they have less bacteria entry than we who put a Foley in. And I don't know, but I'm just telling you, if somebody's at home and they're doing SIC, self-intermittent catheterization, they just have to be clean. And of course the catheter has to be clean. It doesn't have to be sterile. They usually will keep them in some betadine or something like that in the bathroom, and then they go in and just put it in their urethra. So SIC, S-I-C, and know that. Montgomery straps, I just can't remember if I've told you, and if I have, just skip or something. But I just need to remind you if I've already told you. Montgomery straps, you make them yourself if you want to, or you can order them. When somebody has a wound that has to be removed, and say 3 and 4 times a day, if they have tape, it's pretty hard on the skin. So somebody came up with the idea of take some tape, and here we go again, back to back. Sticky is facing you. So back to back, and back to back, and then stick the sticky part, and then this isn't sticky. You put holes in it, and you can just open it, and the 4x4s just change them, or the ABDs just change, and then lace it up like a shoe lace. And they're called Montgomery straps. You can make them yourself, as big or as little as you want to. Or as I said, you can buy them from the hospital has them in the supply area as well. But you know, so a lot of times you can make them just as well. Now, Montgomery straps. Let me see what Iridia. I know you know what it is, Iridia, and it's in your brief medication as well. But Iridia, remember, is calcitonin. Iridia is calcitonin, or it will take calcium into the bone. Now, a few things I want to show you or talk about, and one is the Foley catheter, and I don't know whether you can see it. But of course you know that has the appendage that needs a syringe, not a needle, but to blow up the bulb. Anytime you see that kind of appendage without a cap that a syringe would fit, it probably is going to blow up a bulb. If I need to get a specimen, I just put a non-needle syringe on here and put a clamp this and put a rubber band around it and get fresh urine and put a syringe there in about 30 minutes and aspirate good fresh urine. Don't get it from the bag. And I know in fundamentals you learn that. I just have a need to tell you again. If you need to get a specimen, another type of way to do it is this one. Now this bag and urometer. You can get fresh urine from the urometer. You might be able to get some fresh if you empty it and then get the next hour's urine. Or you can do our clamping, get fresh urine, and there is a little pad there that they do allow you to put a needle and aspirate. So just another way of getting the specimen. Now, I did want to show this portable sitz bath. If, especially you all that were in OB and any GYN surgery that might be in the perineal area, and warm water is good for circulation, and healing goes with circulation. And so it's an old, we still do it, but it's a method of healing that I think's lost some popularity because I'm not sure people thought it was that good, but warm area is good for healing. And so in the old days, people would get in a tub and run the warm water, just shallow, and that warm water, besides just cleansing, it caused blood to come to the area and start healing. Well, so many hospitals don't have tubs anymore. So you put this bowl on the commode, and this comes with it, kind of like an enema tubing. You put warm water in the bag, and then you see this little hole right here. So I'm putting the tubing in here. It fits in the bottom in that little wedge, and then this goes on the commode. This hangs up, and the person sits on the commode, and this fills up and overflows here into the commode, and they have that constant flushing of warm water. A portable sitz bath, S-I-T-Z. I wanted to say something about catheterization. You say, now listen, we've learned all that, and we did it in skills and all that. I just wanted to say, when you have your kit, I wanted you to see, you have your kit, and you have opened up your betadine or whatever, and put it on your cotton. See the cotton? You put it on your cotton. Of course, you're sterile. You've got your sterile gloves on. A nurse taught me, I learned from everybody just like you'll be always learning too. With her sterile hands, when she poured the betadine on her cotton, she took her fingers, with her sterile fingers, and broke up the cotton balls. Because have you ever seen anybody catheterize and they pick up, these stick together, and they try to do this? Well, they can't take this hand because the hand's holding the labia open. And they have a time. I've seen people have a time. Well, if before you lose your hand to holding the labia or the penis, you would just separate them, then it's a great trick. I think it's a great trick. And while I'm on catheterization, let me talk about, you can never, ever catheterize that you don't see urine. You're going to always see urine, with the exception of a male. Women, you're always, when you open the labia and start in with your catheter, you don't come out till you see urine. You say, well, they're dehydrated, they haven't had, it's kind of like the story and the gastric secretions. You're always going to have a little gastric. You're going to always have a little urine. And I know one time I thought it was urine, but it was some of the KY on the tubing. And we blew up the bulb, and an hour later, no urine, and then we realized we were in the vagina. So make sure you really see urine, and then blow up your bulb. With a man, though, it's different. So when you hold the man's penis, and you're done all your preliminaries of wiping the head of the penis, and start putting the catheter in, you may go all the way to the end. I've done it where I'm catheterizing the man, and I go on in all the way. This is the head of the penis. I go all the way to here. Do you see? I can't go any further. Well, go on and blow the bulb. I ain't got urine. Go on and blow the bulb up, and it'll come on till the bulb hits the top of the bladder. I ain't got any urine. With a man, it's okay. There's only really one direction. If it went, it's probably right, unless he's climbing the wall and it's crooked and kinked. And they don't let you just lay, they don't lay there and let you do that. If it is crooked up, they're coming out of the bed. If he let that man let you go all the way to here, blow your bulb up, bring it out, and hang your bag up and come back in 20 minutes, I'll promise you have urine. Why? Because it spasmed, and probably his spasming squeezed down on the tube and won't let urine come out. So women always see urine. Men, if you didn't have any trouble catheterizing them, then go on and blow your bulb up and come back in an hour. I was working one night, and it was when they wouldn't let women do it, and a tech did it. But he came back and he said, I just can't get any. I've gone all the way to the top. And I told him, I said, you just blow up your bulb and you got it. So, just a little word. While I'm talking about catheterizing men, push, if you're cleaning and bathing a man and you've pushed the foreskin back, even if he's circumcised, there's a little bit of foreskin that might need cleaning around. Clean around, but if any foreskin, if you had to push any foreskin back and clean, make sure you bring the foreskin back to where it originally was. If you don't, the head of the penis swells, and then the foreskin is like a rubber band, and it's very painful. And you know, there's just no reason. I have been over to the hospital to make assignments, and there's a note saying, Dear doctor, please, the foreskin of the penis will not go back over. Let me tell you, it will. You may have to get some Vaseline or something and work the foreskin back over the head, but please do not say, well, I'll come back later. It's just going to swell, and it's putting him in pain. So I'm telling you, if it was there and you pushed it to clean, make it come back. And sometimes it's really hard to bring it back. So I needed to tell you that. Now, about an enema. I thought I had an enema bag. Well, I'll just use this. If you have an enema bag, go on and clamp it and fill it, usually 1,000 milliliters. If it's soap suds, then you can just have soap and put it in it. Warm water, and I know you learned this. I just want to reiterate, so you're great when you get out. Put KY, I beat you to death on KY and Vaseline last week. Put your KY on the tubing. Get them on their left side and open their rectum, their buttocks, and put it in. Hang this up on the IV pole. And you've got your clamp so it's not pouring out. And I go up as far as I can before I can't go any further. When I was in nursing school, they said 1.5 inches. Well, that's just not, I mean, it just goes and water comes right back out. That's not the worst thing because it stimulates. Anytime you're doing anything to the rectum, it's going to stimulate. So that wasn't the worst thing. But I like to go as far as I can so that it will make, it will stimulate high. And so I go as far as I can, as far as it'll go. And so I have this hanging up, and I can control. I always put that fracture bedpan. Remember the fracture bedpan from last week? I put it under the buttocks of the patient, so if he can't hold it, then I